All right, we'll get started. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the division's preliminary rate decision for Kaiser Foundation Health Plan of the Northwest Small Group fourth quarter rate filing. The division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is how much of every premium dollar goes to pay healthcare claims costs to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. Our agenda for this afternoon will be representatives from Kaiser describing their request. Then division staff will lead a discussion about the division's review and preliminary decision on the filing. Finally, we will accept public testimony. If you'd like to make a comment on a company's filing, please unmute, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. today, April 13th. The division will make a final decision about this rate filing shortly after the public comment period ends today. Kaiser, please begin by introducing yourself and explaining your rate request.
Thank you, Ethan. This is David Liebert, and I'm a Director of Actuarial Services with Kaiser Northwest. And our rate request is for the small group market for the 2023 fourth quarter, so October through December rates only. And we are requesting that we move from the originally filed and approved rate increase of 5.9% to a 7.7% rate change for the fourth quarter. This will affect an estimated 162,000 member months, so just over 10,000 members, which is approximately 46% of our small group market. The change is due solely to revised estimates of our risk adjustment transfers in 2023. Risk adjustment has been a very volatile program over the years, and especially during the pandemic. And as we are, out of the pandemic now, we are seeing our risk adjustment transfers are changing quickly, and projecting from the 2021 final risk adjustment to 2023 provided numbers that are significantly lower than we are now projecting based on 2022 risk adjustment. And no other assumptions were changed for this filing. We did have a slight change in the membership projection, but that doesn't actually impact the rate change as requested.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary discussion, or preliminary decision.
Thank you, Ethan. My name is Michael Sink, actuary for the Division of Financial Regulation and reviewer of this filing. As David has summarized for us, this is a filing that has minimal changes. I should start by saying this is a fourth quarter filing, effective date October of 2023. That is an adjustment to an existing filing that was effective January 2023. If you have any questions regarding any assumptions or review that was done up until the point of the January 2023 filing. There is a place on our website where you can go look at the prior hearing and prior filing to answer any questions there. For the fourth quarter filing, we are looking strictly at the differences from already approved rates. The currently approved rates are the January rates plus 3 months of trend, in this case 1.5% higher than the already approved rates, and this is an adjustment on top of that. So this, if we were to disapprove this filing, still most of the rate increase would take effect anyway. So we are strictly looking at the justification for rates to be approximately, according to the company, 1.8% higher than the currently approved rates. And that is strictly a change in the experience that goes into the model. And we found no issues with that. There were no other changes to assumptions or methodology that would warrant any sort of action on our part against this filing. So our preliminary decision is to approve this adjustment as filed. Now, that said, I would like to talk a little bit about Kaiser's trend information that they provide us in the filing. If anybody who looks through that will see on Exhibit 4, there is significant information that the company provides regarding the trend, the historical trend, and the future expected trends for the company between the experience period, which in this case is through most of 2022 up into the end of the filing period, which is approximately December 2024. So the question is, what did we find there? And we looked at this. We have been looking at or watching Kaiser's filings for their trend for several years now. They use a different methodology than other carriers. They budget what they are willing to spend on their trend from year to year, and they set that out, and they set their claims goals according to those budgets, and then their profitability is based on how well they did according to that budget. We have noticed that has worked in the past for them, but this trend has dropped as low as 2% this year. We were concerned that this was a very low trend given what we know happening in the market, but it's a budget, and we historically have approved the methodology used by Kaiser, and so we approved it for January. We're approving it for this filing. But going forward, we are going to look closer at Kaiser's methodology for setting trend. There are several components that Kaiser does not address in their filings that other carriers do, and just a couple examples of which: they do not separate out what pharmacy costs are trending, and we know that that's significantly higher than 2% anywhere else in the market. So we're going to ask them to spell out what they anticipate things like trend are going to do. We also want to know a little bit about what's happening between different types of services or different network status within the Kaiser network, and have them really drill down what they expect or any problems they're seeing, any trends that they are seeing going forward, because this is where they should put that. We took a look at this historical performance of the small group market, and this particular filing, this particular product has been losing money since approximately 2017. So we are not concerned about Kaiser's financial stability. We're not concerned about their methodology in those years. But going forward, we're going to see if these trend indicators that Kaiser has have not been providing us would lead to more stability in their filings. It's we'll take a look at that come effective the January 2024 filing, which is due mid-May. And that's all I have to say about that. This does not affect the current filing, but thank you for your time.
Thank you, Michael. Kaiser, do you have any additional information or comments you'd like to make at this time?
No, we do not.
All right, the division will consider all information discussed in this hearing before making a final decision on this filing. We will now take any public testimony. Please unmute and introduce yourself. All right, doesn't sound like anyone signed up to testify, so let me remind anyone listening that today, April 13th, is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.